Welcome everyone to the latest webinar with Cosmetic Laser Dermatology. We are very excited to be here today with Dr. Loyal, who is speaking about what's new and what's next. He's going to go over some of our brand new procedures like Skinvive, Potenza, Ultraclear, and SoftWave. These are some of our favorite new devices that we added to our arsenal, so I'm excited for you all to learn about them. And one is an injectable. And we do have a Q&A available at the end. So there is a little feature on Zoom where you can ask questions. So feel free to do that, and we will get to as many as we can at the end of the webinar. We will also, this is being recorded as you heard when you joined. So we will be sending out the recording in case you missed anything, or you're welcome to send it to any family or friends who you think may benefit from this education. And otherwise, don't forget to stay into the end, all of you that are tuning in live for our giveaway. So without further ado, let me introduce you to the one and only Dr. Loyal. We are so glad to have Dr. Loyal as one of our newer associates at the practice. He is a board certified dermatologist. He did his fellowship training at Cosmetic Laser Dermatology, so he was trained by all the best. And he is an expert in all sorts of cosmetic dermatology. So, of course, the procedures we're speaking about today, but all sorts of injectables and laser and body sculpting procedures. And as with all of our webinars, all of our dermatologists do offer all of our treatments. So we are very excited to get into it. Dr. Loyal, take it away.
Perfect. So thank you for the introduction. So good evening. So my webinar, again, as Risa mentioned, is what's new, what's next. So the cosmetic dermatology space is always changing rapidly. And at Cosmetic Laser Dermatology, we quickly stay up on the latest and greatest. So I'm going to delve right into all of that, as well as getting you ready for the holidays. So Thanksgiving is only about 2.5, 3 weeks away. So we want to be thinking about how we can look our best for the holiday season coming up. So over the weekend, myself, along with my physician colleagues at Cosmetic Laser Dermatology, we were at our annual dermatologic surgery meeting in Chicago. And this is a once-a-year meeting where all the derms in the country meet and we learn about the latest and greatest. And the one thing I want everyone to be rest assured about is that many of the technologies and treatments that were discussed at this meeting, we have already been doing at our practice for at least a year, or if not longer. And that really highlights that all of our treatments are really based in research, and we like to have evidence-based treatments for our patients, and that's why we are always on top of everything that we can offer you. So what's new, what's next? One of the things that that I speak a lot with my patients is the importance of skin quality. And in my opinion, if the skin is as healthy as it can be, then all the other treatments that we do, including dermal fillers, neuromodulators, skin tightening, will look better if we're already working with a healthy canvas. So what is skin quality, or what are the attributes that I look at when evaluating a patient for improving skin quality? One of the first things I want to point out is the actors on the screen. So Anne Hathaway and Paul Rudd, they look absolutely amazing and have aged gracefully. And one of the attributes that I think really makes them look so youthful is that their skin quality is flawless. So the coloration of their skin is evenly toned. The texture is also even. There is cohesiveness between different areas. So the face matches the neck, matches the chest. And if you could see Anne Hathaway's hands, they probably already match her hands in terms of the best quality that the skin can be. So one of the really important things that we want to improve is the coloration of the skin, meaning that there is no sun damage and pigmentation is at a minimum. Redness is improved, and also at a minimum, any broken capillaries can be treated. Any dullness to the skin. So we are going to be talking about a new treatment that can improve dullness to the skin that we previously didn't really have a great treatment for. Fine lines and wrinkles, so making sure that the movement of the skin is even and there's no deep furrows. The texture of the skin, so are there any scars? Are there any irregularities or crepiness to the skin? We can improve that to make the skin not only look better, but healthier. Is there a little bit of laxity? We can improve that with treatments I'll be discussing shortly in terms of skin tightening, improving collagen, stimulating that to make the skin as firm and as elastic as it can be. And then a new category, which we've been talking about at the previous meeting I discussed this weekend, is hydration, and how hydrating the skin is really makes the skin the most healthy it can be and improve the overall skin quality. So all of these things we can really target with a customized treatment plan to each individual patient. So this is our aesthetic maintenance one-year outlook that I go through with my patients. And we talked about a lot of different categories in terms of skin quality. And again, how does this fit into a treatment paradigm in terms of fine lines and wrinkles? We could easily improve that with neuromodulators such as Botox. The coloration, pigment, redness, and texture of the skin is something that we do every single day at CL Derm in terms of our laser treatments. And we have over 50 devices, so we could really handpick and curate a treatment laser plan for each individual patient. We can lift and firm the skin with skin tightening, and we could even improve crepiness with something as easy as a biostimulator like Radiesse or Sculptra on the face or on the body. And then I want to hone in again on this new category in terms of hydration. And I really do think it is a new category because prior to the next treatment that I'm going to be speaking about, which is Skinvive, in terms of a skin booster, we really didn't have a procedure to improve the hydration. Yes, you could drink more water, you could apply topicals, but to get really deep hydration from the inside out, we never really had anything like a skin booster. And then, of course, in addition to what we do in the office, you can't be in my office every day, although I would love to have you in there every day. We need to boost the results and maintain the results at home. And how we do that is with really good skincare, and skincare with ingredients that, again, are backed by science and really will further add to your result that we could get you in the office. So this new category, skin boosters, we've been waiting so long in the United States for a skin booster. Canada and Europe had them years ahead of us. They're extraordinarily popular in Canada and Europe with a skin booster such as Profilo here highlighted in a magazine. In Canada and Europe, there was a product called Volite, which we just got here in the United States, which is called Skinvive. And these products are not fillers. So I know there's been a lot of patients having a lot of fear about dermal fillers. And I want to make everyone aware that these products are not fillers. So when I speak to my patients, I explain to them that a skin booster is not going to volumize the face. It's not going to change the contour of your face. It's not going to make you look different, but it's going to deeply hydrate your skin to give you a bit of a glow. So you're going to look the same, but better, which I think a lot of patients are really looking for. And this treatment is beneficial for all age categories. And basically everybody would benefit because everybody wants more hydrated skin, especially as we go into the fall and winter months. So Skinvive, it's by Allergan, it's a Juvéderm product. Again, it's not a filler. It's the first FDA-approved skin booster here in the United States. It is an injectable. It's made of hyaluronic acid. So hyaluronic acid is just basically a sugar that is in our body already. Your joints are made of hyaluronic acid. There's hyaluronic acid in your eyes. So this molecule is deposited in a very gentle way in the skin in the upper layers of the skin to really hydrate, act as an internal moisturizer to improve skin smoothness, as well as give you a glow, improve luminosity. I tell patients that if the skin is as hydrated as it can be, the light can reflect better off the skin and then you'll look more glowy. And who doesn't want to look more glowy? The good thing is that in all the clinical studies, again, bringing it back to the science, so I never recommend something without data. It lasts 6 months, which is a benefit. So this is a treatment that becomes part of your wellness cycle, part of your wellness routine. You come in almost like akin to a teeth cleaning. Twice a year, we do your Skinvive, your skin will be hydrated. The other component is that this treatment is additive to your regimen already. So we could combine it with lasers, we could combine it with traditional injectables, be it dermal fillers to volumize or contour, and of course your neuromodulator. All this can be done on the same exact day. So again, bringing it back to the science, how does it improve skin hydration? It boosts the cells in the skin, some of the proteins to bring more water in. Results are as soon as 5 to 10 days post-treatment. Here are some dynamic results where you could see the luminosity of the skin is a little bit better. But the one thing that I want to highlight is a lot of my patients are mentioning that their skin feels healthier. So it's not just a look that we're going for. We want to get back to how do we make the skin more healthy? And it's also making your skin feel more hydrated. So here's a quick video of me demonstrating Skinvive. Hi, I'm Dr. Jameson Loyal, Cosmetic Laser Dermatology. Today we're doing my new favorite treatment, Skinvive. So it's a skin booster. It's not a filler. It's meant to deeply hydrate the skin to give you radiantly glowing skin. So watch me as I inject a full face with Skinvive. And you could see the patient is extraordinarily comfortable. We could topically numb the skin. The treatment is quick, takes between 5 and 10 minutes. And we're doing micro droplets. So we're using the tiniest of needles, and it's a quick, easy treatment to incorporate with whatever else you're doing while you're in the office. We like to maximize your time. So I'm going to fast forward just for time. So again, how do we combine this with other things that can improve your skin quality? So again, we talked about the coloration of the skin, making it as even as possible. I like to use intense pulse light, or IPL. That will improve the brown spots, the redness, the sun damage. Next, I like to target hydration. So that's where the new product Skinvive will come in. I always like to boost collagen. I'm always talking about how can we bank collagen? And that's something that I think everyone should be thinking about. So we could gently improve the texture, firmness of the skin, and develop collagen with a light laser called Clear and Brilliant. Again, this is done all on the same day to maximize your time as the patient. And this is, in my opinion, no downtime. So if you might be a little pink, you could still wear your makeup, you could go to dinner that night. And then finally, targeting the dynamic wrinkles, the fine lines, we use, of course, our Botox, which everyone's been accustomed to for over 20 years. So here's a quick video of demonstrating this combination approach of using our Skinvive, as well as here we're starting with our intense pulse light, or IPL, to target the sun damage. And this is done in quick succession. So when you come in for this, we're moving you from room to room. You get a tour. Our wonderful medical assistants guide you through the whole process. Here I'm injecting the Skinvive. The patient, after the IPL, we do a little topical numbing for about 30 minutes. The patient is extraordinarily comfortable. This part takes all of 10 minutes. And then after the Skinvive, again, we want to boost collagen. And we do that with a gentle laser called Clear and Brilliant, which can be used in all skin types, minimal downtime, get you back to your routine as quickly as possible. So again, here I'm doing the Clear and Brilliant. The patient is comfortable, only minimally pink post-treatment. She could go out right from the office, put makeup on, no issue. And then of course, finishing with Botox. Who doesn't like Botox? And then skincare, of course. So here's a before and after of the patient in the video with one combination treatment of IPL, Skinvive, Clear and Brilliant, and Botox. Her skin is nicely radiant. Her skin, again, is healthier with building collagen, hydrating the skin, improving the sun damage. So that was Skinvive. The next treatment that we're going to talk about is radiofrequency microneedling. So there's tons of devices out there. The newest one on the market is Potenza. And the reason why I like Potenza is that we could not only treat so many different things, but we could really customize the treatment to the patient. So unlike other radiofrequency microneedling devices where you're kind of stuck with the settings that the device has, the Potenza, we could really key in every little minute setting for each specific patient. There's 9 different tips. They all do different things. We could even infuse topicals into the skin to give you even more results. So that really is a game changer. This treatment is safe in all skin types. It's minimal downtime. I've had it done. You're a little bit pink. You could go back to work in no time with this treatment. And again, we could treat acne scarring, skin texture problems, crepey skin. We could use it off the face, so neck, abdomen, arms, lots of different areas. We're even looking into using this device for melasma. So this microneedling device, it's warming the underlayers of the skin. By warming it, we're developing collagen. And the microneedles also develop collagen. So what I like to tell my patients is that you're getting almost like a double collagen stimulation effect, not only from the needles, but from basically warming that dermis where you could produce collagen, make the skin more smooth and tighter. And here's just a graphic of what does that collagen stimulation look like in the before. There's not as much collagen. The collagen is unorganized. In the after, the collagen is more robust. There's more collagen fibers and it's much more organized, demonstrating more healthy skin. So we could rejuvenate the skin to make it more healthy with this treatment. Again, many different tips. One of the really interesting things is that we have an infusion tip. We can infuse even the hyaluronic acid like Skinvive into the skin. We could infuse other topicals to treat, let's say, melasma, which other radiofrequency microneedling devices, we just didn't have the capability in the past. There's also a tiger tip, where there's 2 bands of radiofrequency energy. Essentially, what does that benefit you as the patient? We could get through the treatment a little quicker, or we could give you a more robust treatment. It's almost like doing 2 passes in one. And then we even can target small little blemishes with a single needle for a very precise treatment. So here are some before and afters. Here for the body, we could treat stretch marks, laxity of the abdomen. The neck is a very difficult place to treat. Even Martha Stewart was talking about on her social media about a questionable neck. No one wants a questionable neck. And this is one way with minimal downtime, it could be tighter with less crepiness. The submentum or jawline, so that little bit of laxity there, that could be improved with radiofrequency microneedling. And in this photo, the skin is a little bit tighter, the complexion is more even, and this is just done with microneedling. Acne scarring, so we treat a ton of acne scarring. It's probably one of the most challenging scars to treat. With 3 treatments, much more improved. Even some of the active acne looks better. Severe acne scarring here, he still needs more treatment, but significantly improved compared to where this patient started. And here we could see a little demonstration of the treatment. So the patient is completely comfortable. We have the cool air blowing on the skin to make it even more comfortable. The skin is just minimally pink post-treatment. It's relatively quick. And within 2 days or so, that pinkness is basically gone. I tell patients how you're going to care for your skin is very important. Basically, gentle cleanser, gentle moisturizer, sunscreen, and you're good to go. So the next treatment or device that we brought into our practice about 6 months ago is this Ultraclear laser. So, of course, we're known for our aggressive laser resurfacing treatments, such as the Take 10, but we also understand that not every patient has the downtime or the schedule for that type of procedure. So how can we give you a resurfacing with minimal downtime? And this is where the Ultraclear device comes in. So it is a resurfacing laser. It's basically a newer version of an erbium laser. But what's really key is that we could complete the treatment with just topical numbing. So what makes this laser new and unique is that the beam of the laser is broken up to make the laser treatment minimal in terms of downtime and minimal in terms of discomfort. So we could get really dynamic results in terms of improvement of sun damage. We could improve texture and scars. There's even a new feature on the device called laser coring, which is a new category within the laser realm in terms of the laser being able to take out minuscule portions of the skin so that it tightens upon healing. And again, this is minimal downtime. So where other treatments might take 7 to 10 days to heal, you could be healed up within about 5 days. We could also treat the face and off face. So I'm actually doing a clinical trial now. So we always like to gain more evidence, more data in terms of our new devices. So one of the studies I'm conducting that's in the final portion of the study is treating the face and neck with this laser. The patients are very happy. There's significant improvement in sun damage and texture. We could even treat the hands. Now, let's say you have even less downtime. You only have a day or so. We could even dial back the settings to give you a lighter treatment. So that's one of the things that where the consultation really comes into play in terms of what is your lifestyle as a patient. We want to know all that information so that then we could really curate a treatment plan that is individual to you and your goals. So here is some before and afters. And the left on the top, the photo on the left, there's that sun damage is reduced of the laxity around a single treatment. And then the photo on the lower right, again, improvement in sun damage, and the skin looks healthier and tighter. So the next treatment, so we talked about skin boosters, how to hydrate the skin. We talked about Potenza, how to improve texture and build collagen. So SoftWave is a different category. It's a non-invasive skin tightening procedure that uses ultrasound. And this is different ultrasound than what you get to have a medical imaging image done, but this is ultrasound that goes into the deep layers of the skin, again, to basically warm the deeper layers to build collagen. It almost tricks the body to regenerate itself so that it repairs itself and builds more collagen, which will result in thicker skin, and thicker skin means tighter, more lifted skin. So again, this is no downtime. You could have the procedure and go to dinner that night. It's fast, so compared to other previous technologies in this same non-invasive skin tightening category, we could complete a face and neck treatment in under an hour or so. And it's FDA cleared for lots of different indications. So we could lift the brows, the lower face, the neck. We could even improve cellulite and acne scars with this device. And again, how does it do it? It's building collagen and elastin. So here I'm going to be demonstrating SoftWave on one of my colleagues. So we're got that going. Hi, I'm Dr. Jameson Loyal, and I'm here with my esteemed colleague and friend, Dr. Kimberly Butterwick. And we just had a busy day in clinic, and so now we get to treat ourselves. So I'm treating Dr. Butterwick with one of our newer devices. It's called SoftWave. Uses ultrasound technology to tighten and lift the skin. And so we're doing this to the face and neck. And it's a relatively comfortable procedure, and you will have more collagen and elastin to make your skin look refreshed for the fall season.
So I just want to have a little bit of tightening like we all do in lifting. And this is something good to do. It's really not too bad. Of course, I have my little friend some nitrous to puff on when it gets a little painful, and a vibrating device. And with that, I'm very comfortable. And this will be have no downtime. So this is how we do our maintenance, stay a little lifted.
So here I'm just using the handpiece, and we'll just march along the face to give some nice lifting. And again, about an hour.
Thank you so much, Dr. Lawrence.
My pleasure. We could treat the face and neck. So really nice treatment. It also can be combined with other things. So what would I do on the same day as someone getting a SoftWave procedure? So we want to talk about how to maximize the patient's time. So we could improve sun damage on the same day. How would I do that? I would use IPL or Clear and Brilliant. In addition, I even do the Skinvive. So we maximize collagen stimulation, we improve sun damage. Now we should think about hydrating the skin. So on the same exact day, you're already numb for the SoftWave, we will do your Skinvive. Hi, I'm Dr. So again, another video. I'm just going to advance so that we have time for Q&A, and so we could get through our other new devices and treatments. Again, here I treated a patient face and neck. She was really happy, quick procedure. And again, you could combine it with other things on the same day. Hi, Dr. Loyal. So here are some results with one treatment. You know, there's some gelling that could be lifted with SoftWave with one treatment. Some patients need an initial 2, and then we go into maintenance. And what does maintenance look like? Again, it's customizable. Some patients like doing this yearly, some want to do it every other year, and that's really unique to the patient. Here again, another nice demonstration of lifting that gelling and neck area right under the chin that can be very hard to treat. I recently completed a study looking at improvement of crepiness on the inner arms, an area often neglected. And here, one treatment, improvement in crepiness. Again, improvement of crepiness, one treatment, some nice improvement. And we could either further improve with biostimulators like Sculptra or Radius, and that too can be done on the same day. So a cure, I know we maybe have spoken about this in the past, but I think it's worth a highlight because we've done a lot of groundbreaking work at CLD on this device. It's a laser treatment for acne, FDA approved a year ago for the treatment of mild to severe inflammatory acne. We were one of only a few offices in the country to do the initial clinical trial to get the FDA approval. We have subsequently did another clinical trial for further data to further solidify that this treatment is really a game changer. And with 4 treatments, we could get results akin to Accutane, but without any systemic medication. So that looks like an 80% reduction of inflammatory acne lesions, again, with no oral medications. It's safe in all skin types, and the results are durable, and we're still learning. The device has only been studied for 2.5 years, and there's still improvement in patients' acne. We're basically shrinking the oil gland. So I liken it to almost a Accutane-like result without the harmful effects of a systemic medication. The treatment is relatively quick. It's no downtime. You could go back to your routine and just wear your sunscreen and you're good to go. Again, it targets the oil gland or the sebaceous gland. It's the powerhouse of acne. It's going to shrink it down. So with the sebaceous or oil gland smaller, the acne will be less robust. And here we even took biopsies to demonstrate how the active oil gland is quite big, and then on the untreated side, and then on the treated side, you could see that the little cells within the oil gland are no longer there. That means that oil gland cannot produce as much oil and not give as much acne burden to the patient. Some nice results, again, after 4 treatment sessions. Significant improvement of these really hard to treat inflammatory acne lesions, which if we don't treat will cause prolonged redness to the skin, can cause scarring, cause a lot of problems. So we talked a lot about a lot of different treatments this evening. We talked about what is skin quality, why that should be one of the hallmarks of any treatment plan of making the skin not only look as best as it can be, but as healthy as it can be. And then all the other treatments we do will be a more dynamic result in terms of dermal fillers, neuromodulators, if we're working with a good canvas to start. We then talked about the importance of hydrating the skin with Skinvive, the newest injectable in a new category of a skin booster. Then we re-highlighted Potenza, a new radiofrequency microneedling, which really is at the core of what CLD does, because we customize everything to every individual patient. And that treatment allows us to really dial in every single setting to really target what the patient wants and their goals. We spoke about a new resurfacing laser in terms of Ultraclear, where we could give you a light treatment or a more aggressive treatment based on one's lifestyles and needs. We also could do a new laser coring to take out little bits of skin to make it tighter, particularly in those pesky areas such as the jowls. We also spoke about soft wave, where we could tighten the skin non-invasively. You could go to dinner that night, could be used on face, off face, and it could be incorporated with other treatments such as lasers for sun damage and Skinvive for hydration. and then re-highlighting a cure and all the work that we have done at Cosmetic Laser Dermatology to get that technology in the hands of lots of our patients to help really cure acne without medication. So how do we make a treatment plan for the holidays? Because Thanksgiving is basically, 2.5 to 3 weeks away. So we want to highlight high impact treatment. So how could you look the best you can in the shortest amount of time? We've talked about a lot of these. Again, looking at basically skin quality, and of course a little filler here and there never hurts. We could lift the cheeks, contour the jawline, volumize the lips with, again, a no downtime dermal filler procedure. So here's a nice multimodal approach to improving one's overall skin, which could be done for the holiday season, where we used IPL and Clear and Brilliant. This was one treatment session, and she looks really great. So another side profile. The redness is improved. The photo damage is improved. You even get some collagen stimulation from the IPL along with the Clear and Brilliant, because it's warming that dermis where the collagen is produced. So I think for the holidays, we're looking for high impact so that you could get to your holiday events with minimal downtime, but people are saying you look well rested, your skin looks glowing, but they can't put their finger on what you had done. I think that's one of the goals. So with that, I think we'll go to some questions. So type in your questions in the Q&A box below. Risa will moderate, and I'll give some answers on what the hot topics are.
Perfect. Thank you so much, Dr. Loyal. That was great. It is so, just remove your screen sharing so we can see you. That was so great. It's so great to hear about all these new procedures and treatment options from you. And we do have a few questions. And like Dr. Loyal said, anything else, just pop them into this chat. All right. So first question, does Skinvive actually improve skin over time, or is it just a superficial treatment that only improves it while it's there temporarily?
So in my opinion, hydrated skin is more healthy skin, and the science behind Skinvive is that it's upregulating some of the protein transporters in the skin. A lot of science speak, but it's basically bringing in more water. So in my opinion, it's making the skin healthier for the long term. But with everything, you maintain your teeth by going to the dentist and getting your teeth cleaning. You maintain your car. So we need to maintain our skin. So I would say anything that's a one and done, you have to maintain it. And this is part of one's wellness routine. So I explain this to a lot of my patients. So everyone wants to be as healthy as possible. We eat well, we try to exercise, we try to get restorative rest. This is just another realm that we need to be focusing on or cognizant of, that our skin health is part of all those other realms that one places importance on.
That's a great analogy and way to think of it. Okay, here's a great question. How do the results of Ultraclear compare to Clear and Brilliant?
So Ultraclear is different than Clear and Brilliant. So Ultraclear, we can do a minimal downtime or no downtime light treatment. That specific treatment is called 3D Miracle. And with just topical numbing, you could get improvement of photo damage like Clear and Brilliant. So they're a little bit different. Clear and Brilliant works a little bit differently, but Ultraclear could give you a little bit more results if you could give me a little bit more downtime. In addition, if you want even more results in terms of improving etched lines, crepiness, we could use Ultraclear for those issues as well to improve that. Of course, the more results you want, you need to give me a little downtime, like maybe 5 days.
But it's worth it, right?
Worth it.
Yes. So can you compare a cure with the smooth beam laser in terms of effectiveness?
So they're different. So the Acure Acne Laser is one of only 2 devices with this specific wavelength, the 1726 nanometer wavelength. And so it's specifically targeting the sebaceous gland. So no other laser can target the sebaceous gland to really shrink it down without disrupting the other skin structures. Other lasers in the past, so this is a newer, better technology. In the past, we did not have a specific laser for oil glands. So how we treated it was basically by treating the entirety of the skin, which could lead to more downtime. This is a no downtime modality.
Thank you. How does the Potenza compare to the Profound RF?
Right. So Potenza and Profound are a little bit different. So in my opinion, Profound is an older technology. Some people would say that it's profoundly painful. And so there's just newer, better technology. So that's one of the things that we really pride ourselves at CLD, is that we keep up with all the new modalities, not only by doing our extensive research in our research center, but going to conferences and testing out these devices. So how is it different? It's not as painful as Profound, so patients are comfortable with just topical numbing cream as opposed to having to do injectable numbing with Profound. And to me, if I was to get a treatment, I would want something that is comfortable but gives me similar results. So that's what I would do. Potenza.
All right, a few more questions here. So how can an out-of-town patient have a consultation with you?
Very easily. So we're very accustomed to out-of-town patients. We love them because they're so interesting. So we not only get to treat you as a patient, but we get to learn about where you're coming from, because I always like to travel. I like going to new restaurants. So I learn so much when we get our out-of-towners to our office. So how can you easily get a see me is virtually. Call the office. We will coordinate with you in terms of getting a virtual consultation to really see what your needs are. We have wonderful staff. So it's not only me, this is a team effort. So our nursing staff will coordinate everything with you. If you need a driver, we will even get you a driver. So we try to make it as easy as possible. But this is something we do every single day. People fly in, drive in. I don't know if they boat in, but
maybe we are in San Diego, but yes, we have had people come in from around the world. And just like Dr. Loyal said, we also have a couple of hotels that we recommend and have some special rates at as well. So we definitely are very used to accommodating out-of-town patients. And it's after hours now for us, but you're welcome to use the contact form on our website. I will pop it in for you. So here's a thank you so much for the wonderful presentation. I am wondering if there is an upper age limit to any of the treatments you've spoken about today.
So there's no upper age limit. I think everybody wants to look and feel as healthy for as long as possible. So these treatments, first and foremost, are safe. So in all age categories. So I treat very young patients, I treat mature patients, and everywhere in between. So every age group we can treat, but that's why the consultation is the foundation of what we do. We want to know what your goals are, what your expectations are, and how can we customize a treatment plan that meets what you're looking for and your lifestyle, your needs.
Absolutely. All right, so a couple questions about Potenza. So how does it compare to the Intracell?
So they're similar. They both are, the inner workings of Potenza is actually made by the same company as Intracell. So the main difference is some of the unique newer tips for Potenza. So Potenza, we could infuse things with an infusion tip, which might be beneficial for melasma. There's a precise tip, so for treating individual blemishes, that is beneficial. So again, that brings it back to the consultation, because every patient's needs are different. So Intracell might be appropriate for one patient, and then for other needs, Potenza might be more appropriate.
And how do you determine what depth to use with Potenza?
Right. So that's extraordinarily important. So things that are going on in my brain during a treatment is, where am I treating? So am I treating the cheek, the neck, the abdomen? That comes into play. Also, what are we treating? Are we treating a really robust acne scar? So we might have to go deeper, as opposed to crepiness, which is more superficial and not as deep. So all those things are going on in my brain. And that's why it's important to see a board certified dermatologist that really has expertise and has done the research, because I've done the Potenza and some of my colleagues have done the Potenza study. So bringing it back to the data and the science is key.
Yeah, I love that. And I mean, you bring up a good point. At a lot of practices, this may not even be done by a board certified dermatologist, right?
Correct. So one of the things that we pride ourselves is that the physicians do the treatment. So what I recommend I do, and yeah.
Yeah. So it's not just giving some settings and walking away. There's really customization happening even in real time while you're treating.
Yeah, in real time, because the skin, we're looking at what we're treating in real time. We do have to sometimes adjust to customize. If a portion of a scar is deeper, if it's a big scar, one portion is thinner, the other's deeper, we have to change the settings. It's not cookie cutter. And that's what makes our results stand out, is that nothing is a cookie cutter approach.
Love that. Okay, last question for you. Should we wait before trying, since all these procedures are so new? Should we wait to see and have some more experience under our belt, or do you think they're ready to be used?
No, you should not wait. And I bring it back to the research and the science. So although these treatments are new, they're not really new to us at CLD and not new to the doctors. So it takes years and years to get one of these devices or injectables to the market for the FDA to clear it. And what goes into it behind the scenes in our research center is years of dedicated scientific research, where these devices are vetted not only internally by us as the doctors at CLD, but then we talk with our colleagues across the country in terms of what we're seeing, and can these results be replicated? And then the FDA approves it. So these treatments, although they're new, I've known, the doctors here at CLD have been using them in our research center for years before. So they've been vetted, and we're just so excited we can now offer them to our patients.
Yes, thank you so much for explaining that. And if it helps, everyone, your safety, if you're watching this, is our top priority. We're not bringing on any devices or technology that aren't FDA cleared and that have been thoroughly tested and, peer reviewed, and we know they're safe. So with that in mind, I think we have gotten through our questions. Excuse me. And Dr. Loyal, thank you so much for sharing with us. It's so great. We can read about it on the website or in an email, but it's so great to hear it from you about these new treatments. For everyone that tuned in, thank you for coming and spending some time with us. We hope this was helpful, and we would love to see you in the office. And if you do come see Dr. Loyal, please make sure to let him know you saw this webinar. Otherwise, we will be choosing our winner as soon as we hop off here, and we will notify them in the morning. So we're not calling you all too late. And we will look forward to seeing you all as soon as possible. We are in our busy season right now. So if anyone wants to get in before the holidays, I highly recommend booking as soon as possible. And you can book online after hours. So you can book online tonight or tomorrow, because we are booking up very quickly. It's crazy to think, but it really is almost the end of the year here. So if you want any of these treatments done before the holidays, this is the time. And Dr. Loyal, thank you again so much for your time.
Love it.
All right, everyone.
See you in the office.
Yes, see you all at Cosmetic Laser Dermatology. Bye.